morning, everyone.
Good morning.
I think this is a wonderful start. For all of the clips that we saw, we have been royally welcomed by the president of Blue Mountain College, the president of Alcorn, the president of Copiah Lincoln, and representing Mississippi State, the vice president, Dr. Regina Hyatt Young. So I shall just start simply saying, I'm Corinne Anderson. I am immediate past president of AAUW Mississippi. And just to remind everyone, the mission of AAUW is to advance gender equity for women and girls through research, education, and advocacy. And we have been empowering women since 1881 on a national level, and Mississippi joined the tide. Welcome again to everybody, but particularly to our students who are on, because you are the future, and we want you to make sure you have AAUW memberships as a student, and that you help us to move forward and to do those things that you are looking for AAUW to do. It is my pleasure to simply say, Dr. Stephanie Duguid is going to be the panelist, the moderators. She's going to work with them. She's the Dean of Academic Instruction at Copiah Lincoln Community College. She has a wealth of experience, and she definitely is dedicated to the interest of advancing gender equity. I want to say to everyone, enjoy. The first day is health, and health, again, you heard my favorite person talk about that, and she's a woman among women. She has walked the walk, she talks the talks. That's Helen Sue Parrish. She is our queen. And welcome again, everyone, to AAUW Mississippi's first day of a wonderful 3 days, health.
Thank you, Dr. Anderson. I appreciate the welcome and the introduction. Good morning, everyone. I am so excited to be a part of this wonderful and innovative event, the Health, Hope, and Her American Association of University Women of Mississippi Spring 2021 Virtual Convention. I'd like to first share a special thank you to Copiah Lincoln Community College's e-learning director, Dr. Amanda Hood. She has been the brains behind all of the technology set up in preparation for this event. This is all possible due to her involvement, so thank you, Dr. Hood. As Dr. Anderson mentioned, my name is Stephanie Duguid. I am the Dean of Academic Instruction at Copiah Lincoln in Weston, Mississippi. I serve as on the residential campus on the college and oversee all academic divisions, including associate degree nursing, the library, and e-learning. My background is not only in education and curriculum, but also sports medicine. So that's where my interest comes with health. I started my career as an athletic trainer in the university setting and have a passion for helping individuals become the best versions of themselves. So I'm thrilled to be the moderator of all the health presentations and conversations today, focused on wellness for Mississippians with a focus on early childhood education and pediatric healthcare. For this session, we will have 2 different panels. Each panel will have a segment for questions I will provide, and then if time permits, we will ask for the questions from the audience. Please be sure to submit those in the question and answer area, or the Q&A button of your screen. First, we welcome to the panel Ms. Eloise McClinton and Dr. Veronica Valdez. Thank you both for being here today. We will start by first asking the panelists to briefly introduce themselves. Let's start with Ms. Eloise McClinton.
Good morning, everyone. It is great to be here, and thank you, Stephanie, for just allowing me to be on, as well as the one who, Ms. Kay Bacata, who asked me to join you. And my name is Eloise McClinton. I'm the executive director of ICS Head Start, and it's called the Institute of Community Services, located in Holly Springs, Mississippi. I've been the executive director since 2000. Can you hear me?
Yes.
Okay. Since 2008, and it is quite a great duty to be over 14 counties, over 4,000 children from birth up to age 5. And we are in the northern part of Mississippi, as well as the Golden Triangle and the Delta. So we serve a vast variety of areas, and where we have over 900 employees, and in the day-to-day operations that I conduct is ensuring that our Head Start children are getting to school safely, that they're getting the great foundation that they need before they go to kindergarten, as well as providing a safe working environment for staff. And this is an awesome task because you never know what happens from day to day, and the safety of children and working with parents. And I'm just enjoying it because it's a thrill and something different every day.
That is wonderful to hear. What a blessing it is. So thank you so much for sharing your introduction. Dr. Valdez, please introduce yourself briefly.
Good morning, everyone. First of all, I would like to thank the AAUW Mississippi chapter for inviting me to speak before you all, a special group of empowered college students who aspire to work in the medical field someday. I am a general pediatrician and have been practicing in the Northeast Mississippi area for the past 27 years now. 14 years with the Tupelo Children's Clinic, which is affiliated with the North Mississippi Medical Center in Tupelo, and with Williams Medical Clinic in Holly Springs, where I have met Miss Eloise once upon a time. We worked together.
Right.
Yes.
I was going to
It's good to
tell
see
you
you
that.
after all these years.
Yeah.
Anyway, you will learn more about me as the panel discussion proceeds, and that's all I can say for now.
Thank you so much, Dr. Valdez. Now, Ms. McClinton shared kind of a typical day already in her introduction. Can you share with us what a typical day looks like in your position?
Is it me or?
Yes,
okay.
yes.
Okay, so on a daily basis, I see infants and children from newborns to age 17 or 18. I encourage parents to transition their children to adult medicine once they enter college. I do well visits, which entails preventive care, such as providing vaccinations, nutrition and healthy lifestyle advice, and developmental screenings. Sick visits are, of course, a big part of my practice during my typical day at the clinic. I also see infants and children with special needs for which our clinic is their medical home. These are autistic kids, those with developmental delays, and problematic premature babies, providing their well and sick needs and coordinating their care with the different specialists who they see. I belong to a group practice with 7 other pediatricians and 2 nurse practitioners, and share newborn nursery calls with the other pediatricians on a rotation basis. During call days and weekend calls, I do rounds at the newborn nursery at North Mississippi Medical Center Women's Hospital. And used to be, we covered the hospital's inpatient pediatric service as well, but fortunately, we now have pediatric hospitalists who have taken over the role.
Great, thank you so much. Ms. McClinton, did you have anything to add to your daily activities that you get to do each day?
Something similar as Mrs. Dr. Valdez, because we also oversee the nutrition of the children and ensuring that kids get nutritional meals, developing policies for the organization, and ensuring that we are hiring the right staff to teach the children from the educational standpoint and deciding what is needed and what is the most important that's needed for the organization. And we work with infants and toddlers, and we just and helping developing grants. We just received a grant, our early Head Start expansion grant for 96 children in 7 additional counties. So
wonderful.
I'm just excited to constantly do things that's going to help the community.
Yes, that is fantastic. So I'm going to ask a few questions and I'll go back and forth between the two of you. So the first one's going to be, why did you choose this field? Ms. McClinton, we'll continue with you right now. Why did you choose this field?
Well, I think the field chose me. Eventually, I started off working at a mental health facility. I was the mental health counselor here in Holly Springs, Mississippi, and working with marriages and mental illness and doing all of these things. And I just love working with people and families and ensuring that things change or making a difference in people's lives. So when the opening came for a Head Start social services director, I decided, I said, I will be working with the whole child or the whole family. So I really wasn't even thinking about it. I just kind of tossed my application in and they hired me. So I said, wow. And I just moved up through the ranks because Head Start is such a wonderful place to work. And it's such a wonderful part of everybody's life because it started with your infant child and the parents are entrusting their child into our hands to give them, not the parents are the first educators, but we are like the secondary educators of their children. And when they're moving those children to us, I just get a joy of saying how I'm impeding all of that knowledge into them or trying to with those children. So I'm just excited whenever that's happening. When I moved up the ranks, I said, my goodness, didn't want to be an executive director, but the task, God Almighty decided it was time for me to move into something else.
Well, you can definitely tell that you enjoy what you do, and that's wonderful. So thank you. Dr. Valdez, why did you choose your field?
Okay, according to my mom, I was like playing doctor with my dolls as a child. She then encouraged me to become a doctor or nurse. I also enjoyed my visits with my pediatrician, and she sort of became a role model for me and someone I aspired to one day become. I did think about architecture as a career, but because I like creating and drawing, but that entailed being good in math, which I definitely was not. So I stuck with medicine. I chose pediatrics as my specialty because all throughout my medical school rotations, it was the patient population I enjoyed most and felt fulfillment being with and treating the most.
That is wonderful. And so again, it sounds like that the field chose you as well.
You could say that.
Yes. So Dr. Valdez, we'll start with you on this question. Could you tell us a story of how you came to practice in your field?
Okay, I am what you call a foreign medical graduate. I was born and raised in Manila, Philippines, and I went to school there, including medical school, which was at the University of the Philippines College of Medicine. So how did I end up here in the United States, particularly Mississippi? Well, it's a bit of a story. After graduating from med school and completing a year of general internship in Manila, I was trying to figure out where I would further my medical training. I already knew I wanted to be a pediatrician, but did I want to stay in Manila to train or explore another country like the United States? Now, why the United States? The Philippines has a long history with your country, as we were once your colony. We look up to America as the best place to further one's education and medical training. Language was not going to be a barrier, as English has always been the medium of instruction in our schools. I was single and was ready for adventure and a new challenge, so why not? I had to pass a difficult 3-day exam called the Foreign Medical Graduates Examinations before I could even apply for residency here. After doing so, I applied for pediatric residency programs in New York, as I had family in the area. I ended up at the State University of New York, downstate in Brooklyn, which has 3 training hospitals: the University Hospital, Kings County Hospital, and the Staten Island Hospital. These centers were excellent training grounds for pediatrics. Kings County Hospital is the largest and busiest hospital in Brooklyn, which catered to the low-income groups, and the University Hospital and Staten Island Hospital saw mostly private patients. So after my residency, I was again at another crossroads. Do I go back to the Philippines or stay here? I had pretty much gotten used to the American way of life. And by then, my wandering and adventurous spirits prevailed. I, however, was limited as to where I could practice since I was an FMG. Medically underserved areas were the only places open for FMGs, and it would require sponsorship from a government agency and a hospital or clinic employer. Of course, Mississippi is a medically underserved state and part of the Appalachia. I had two friends whom I finished residency with who told me of an opening where they were serving in Holly Springs, Mississippi. With sponsorship from the Appalachian Regional Commission, the then Marshall County Hospital, and the Williams Medical Clinic, I found my first place of employment. I was only required to serve for 2 years, then I could go anywhere in the United States. But lo and behold, love entered the picture. I married someone local from New Albany. So this has been my home for the past 27 years, and where my loving and supportive husband, and with my loving and supportive husband, we have raised 2 children, and where I continue to practice. That's my story in a nutshell.
Wonderful. Thank you so much for sharing. That is fantastic. Ms. McClinton, do you have a story to share in your area of how you came to practice in your field?
Not as elaborate as Dr. Valdez. Well, I am from Mississippi, and I was born in DeSoto County, South Haven, right up the road where my office is in Holly Springs, Mississippi, where I went to college at Russ College. And when I was at Russ and University of Mississippi, I am going to social work, and I told you about that. I just love working with families, and I was the first person in my family to go to college, and I knew that my calling was working with families, working with low-income families, and enticing or encouraging young students they could do better, they could do more. And that's what I wanted to do. And so when I was in, as I said, in social, when I was a mental health consultant and working with those families, and Head Start called me over, I just knew this was the right place to be, because then I would be able to work with young families, young mothers, young fathers, all of those families, and encouraging them, giving them that self-sufficiency of moving forward, so that they too could be able to empower their children to do better and to move forward. And you just have to have a passion for what you're called for, because sometimes you go to school, because when I started, I said I wanted to be an accountant, that was boring. And so I knew that my wondering spirit, as Dr. Valdez said, was more than just sitting at a desk and crunching numbers. Although I'm crunching a lot of numbers with budgets and everything else, but I would be able to talk to families and encourage them and give them passion and give them hope, as this is your theme, help, hope in her, and knowing that we can encourage others to do more.
Well, that is wonderful. Again, it seems like that your passion drove you to your profession, and you both are touching young children in such a way with what you do. So we thank you for that. We'll continue on with our questions. So the next one is going to be, what has been the most remarkable thing about your career path before COVID-19 and after COVID-19, or now that we're in the downhill slide? So Ms. McClinton, we'll start with you.
Well, I think I've had a lot of high points before COVID-19, but the best one that I feel is when ICS Head Start was given the award for working in the communities with organization to help children, and we won that award from the national, and that means we beat out all the other Head Start programs in the nation working with families. And it was the Sergeant Shriver Award, where you are working with community leaders, and we worked with the Rockwell Foundation in Best Morgan Freeman in Tallahatchie County. I guess test pilot program, and that we work there, and that's one of my counties and where we serve. So they the National Head Start awarded us, and I was able to go to California and meet Ty Diggs, an actor, and I, not that that's one of the things. I just thought that was something personal that I enjoyed. But my I guess the best thing is being able to have our children ready for kindergarten, and when they are in that level and they move to the preschool, they are kindergarten. They're able to read, know how to act, know how social engage. They are able to know that someone said, "You've been to Head Start. You've gotten a great beginning," and that's what I really appreciate, that we are able to say our children are making a difference when they are able to go through school and without dropping out, going on to college, coming back and sharing their stories. And I was a Head Start baby. I got my start in Head Start, and now I'm a doctor, now I'm a senator, and we have all of those great things. And that's what I like about it. We have alumni who are Head Start individuals that have done well in Mississippi and all over the world. So it's great to be that you are a part of Head Start, and you have gotten others to make it in this life and becoming what they want to be.
Well, I think that's wonderful that you all had that national recognition, because it is a bonus or a plus for the state of Mississippi to have things that we do have programs that prepare our children in order to be successful in whatever career they choose as they get older and become an adult. So thank you, Ms. McClinton.
Thank you.
So Dr. Valdez, most remarkable thing about your career, either pre or post COVID?
During every step in my career, I continue to see challenges, and with this slow or even dramatic changes in medicine and healthcare, most of them for the good. The practice of medicine and treatment of disease is a dynamic and ever-evolving field. I'm going to give you some examples of what I've seen and what, impressed me the most. For example, in the field of HIV and AIDS. During my residency, I experienced the height of the HIV/AIDS epidemic, of which New York City was an epicenter. I saw a lot of babies and children who had HIV and AIDS. The only medication available then was the antiviral AZT, and now there are lots of antivirals used in the prevention and treatment, that having HIV is no longer a death sentence. Also, perinatally exposed newborns who are identified early and receive treatment at birth end up not having it. So as far as vaccinations are concerned, there is one vaccine that I truly believe in and I'm thankful for. It's the Haemophilus influenza B vaccine. During my residency as well, bacterial meningitis caused by these strains of Hib was a much dreaded illness that I encountered numerous times. It was a significant cause of mortality and long-term morbidity if the child survived, as it resulted in anywhere from blindness and deafness, cerebral palsy, hydrocephalus, and seizures. Thanks to 4 doses of this vaccine available soon after my residency training and when I started practicing, this has practically been eliminated.
That is amazing.
Yes, and another change is electronic medical records. Everywhere in the medical field, we started doing from paper charts, now then proceeded to dictation, where medical transcribers would transcribe our medical records, now to electronic medical records. It has a lot of pros and cons. A lot of older doctors do not like it, and this triggered their retirements. I guess, and the younger trainees or residents, they're so used to it that they won't have it any other way, whereas us who are caught in the middle still struggle with it. So it's a change, but it's good. Now I get to COVID. COVID is the biggest emerging infection in our century. Vaccines are here, and there are more treatment strategies available and are being developed. Hopefully soon this will no longer be a threat and will just be one of the viruses that may strike anytime, but which we may manage effectively and keep from spreading like it has. So
well, thank you. And you've mentioned a few things. I'm taking notes, so if you see me look down, that's what I'm doing. But you mentioned vaccinations. You also mentioned electronic medical records. So vaccinations, we know that things come and go. We know some vaccinations are amazing, and they allow us to make sure that our health and wellness goes in a positive direction, and we don't have some of the terrible side effects that some of these diseases have that our ancestors have experienced in the past. So I am very thankful for vaccinations. And of course, there are new ways that they develop vaccinations now. So the timing might be reduced from multiple years to single years. And so that is a huge process that has changed. Electronic medical records, it's funny that you say that. We have some family members that are in the medical field. And so when a system goes down, when there's a storm and they're so used to doing medical records and they have to write everything, it one slows down the process. And then if you have somebody that's only used to electronics, it's hard for them to stop and go back to the old way. So I think that we still experience that as well with some of our new processes. We get so used with technology that if something with technology is not working, that sometimes we have to stop and go, wait a minute, how did we do that before we had cell phones and computers? So you brought up some great things. Thank you for sharing. So now we're going to go to our next question is, how have you used your passion to propel you and to stay current in your professional practice? And so let's start with Dr. Valdez.
Okay, to remain current and to maintain my medical license as well as board certification, I of course have to attend continuing medical education seminars or conferences. For the most part, I'm passionate about anything pediatrics. So if I see a good meeting out there, good location, that's usually where I go to. Mm-hmm. There are required hours per given year or board maintenance cycle. I have to find time in my busy schedule to accommodate it. Pre-COVID, attending CMEs that I can combine family time and recreation with were always the best. Mm-hmm. Learning and getting to relax with family is always a treat. Nowadays, CMEs are mostly done online like this. Yes. So yes. Thank you for technology.
That's right. That's right. Ms. McClinton, how has your passion propelled you?
Well, such as going to conferences, going into the centers really, and seeing the teachers engage with the children, and me also getting engaged with the children at our centers. I have 20 Head Start centers all over. And when you go to those centers and the children are learning and their eyes are opening, that gives you energize me to say, what else can we do to ensure that we are on the cutting edge of doing everything? And so I'm always out there looking for sessions for myself as well as my staff. I'm making sure that staff are always going to seminars, going to training, going back to school. If they're wanting to go to classes, Head Start, we pay for you to go to classes and to ensure that you're keeping up with everything that is needed. So now since COVID, which is technology, and I'm glad we were all propelled to make sure that we have computers all over. And before COVID, all of our teachers didn't have laptops. We didn't have all of these computers. We had some, just the minimal things to get done. But now all of my teachers have laptops, teachers assistants, laptop, family service workers, laptop. I mean, everybody has everything. We just purchased. I mean, it was like from last year, March of last year up until now, I've been a purchasing machine trying to get to get us into the process of now, when bad weather comes, we don't have to come to school. We can stay at home and do it from virtual learning. We're
right.
in the process. We can do it virtual or face to face. We're just that savvy now. It is Head Start is a passion. It's a love for family, for kids, and for all. So when you think about that, only thing I think of hugging, and now we can't do all the hugging that we used to do. So we now have to do like this.
That's
Pretend
right.
like we're hugging. Yeah.
Well, one of the things that you mentioned is technology. Both of you mentioned technology. And of course, we've all known that technology is there. We've all tried to start using technology. But I think one thing that COVID did is it's really pushed us to be more creative with technology, not only in Head Start or early childhood, but also in medicine and here with our educational institution at Colin. So technology has really allowed us to continue having some sort of normal experience, even when we can't be with each other. So great comments for both of you all. So now, Ms. McClinton, we're going to continue with our next question, which is, what is the best advice for newcomers to your profession?
The best thing, always be innovative. The first thing is, everyone say they love children. Whenever I'm interviewing a teacher or a managing staff, they say, "Oh, I love children," but it has to be more than just loving children. You have to have a loving inspiration for new ideas and what you want to do and where you want to propel that child to move to the next level. So coming in as a new individual, you must have a plan for yourself. Know who you are, because loving children, sometimes it may get on your nerve a little bit. And I know from the standpoint of kids will be kids. And so you as an adult must know that. And you must have a gentle spirit because we have no corporal punishment in our system. So in the past, or when I was growing up, we would be spanked or we did something wrong, but now we don't do that in Head Start or in some of the other places. We are always thinking of what creative ways, how can we direct that child's energy to do something else. So you must be innovative, making sure you have a plan, knowing how to be up and moving and wanting to make changes. How can I make a difference? And that's what I want all of our young individuals to do. When you're coming to Head Start, if that's what you want to be in early childhood, how can I make a difference in the lives of these families that I'll be working with?
Well, and I think that also goes along with what you mentioned about professional development, continuing education, getting out there and going to conferences, hearing what other people are doing, looking for best practices.
Right.
Those are all ways to grab those ideas and bring them back to your area and see what works and what can assist in moving forward. So thank you so much. Great information. Dr. Valdez, so what would be your best advice for newcomers?
So with any career you choose, in order to be successful and happy, you need to love it and have passion for it and embrace it with all its difficulties and challenges. Do not just focus on the good times and what you can derive from it monetarily. Overcoming daily obstacles and how you were able to resolve it in a favorable manner will give you fulfillment. Also, the medical field is a service profession. Always remember that.
That's right. Absolutely. Medicine is service. Well, and so is Head Start. That is a service profession. So thank you both for those answers. Let's continue on with what has surprised you most about your career? And we'll start with Dr. Valdez.
Well, just how dynamic it is and how challenging every working day can be. Just like Eloise said, every day is different. Every day brings on new challenges, different patient needs, different parents' expectations. Sometimes not everything goes well. You can't please everybody. And that's really where the challenge lies. There are parents who resist what you tell them or won't even listen to you. And that can be really, really frustrating. But rewards are there for those whom you see, that I see who have grown up to be healthy and successful adults. I am in that age group now where I have had patients who are now having kids of their own and taking them to me. So this is how much impact I can have to families, especially those who I ended up bonding with through the years, has been very good.
Well, good. Ms. McClinton, what has surprised you most?
Me being in this position. Really, I never thought that I would be like a leader of a whole organization. That totally surprised me because I'm more of a practitioner. I wanted to get in and practice with the individuals that I'm working on. But now being at the helm, I'm making policies and to ensure that things are going the way I think it should go. Never thought that I would be doing those type things, reprimanding staff. I mean, that's something I never wanted to do. But
the
never
administrative
wanted,
side.
Because when you're a social worker, you always want to help and you always want to do. But when you get into leadership, administrating things, that it comes with there's that kind of firing people, and I always say, I'm not firing you, you're firing yourself because you didn't follow the protocol that was called. That was called for. So those things are surprising. But then is the goodness that you can, when you find that when you write a grant and then you are able to get $2 million to provide services within a community. Wow, I love it. When you write a grant and you're able to get a natural disaster grant and you're able to put generators out at your centers for families when the lights go out, my centers can still go on over $2 million some dollars. Wonderful. Never thought that I would be in a position that I could do those type things and to get things done for my families. And I consider my community. These are my families.
Yes.
And I just love it. Every day is different. Every day is not going to be a great day, but
that's right. And that's what makes it so much fun is you never know what to expect. Sometimes it's the challenges, and then you have just the elation whenever you get those big grants. So
absolutely.
Great. So we've got a few more questions for you before we go to our audience for some of their questions. And again, audience, remember, if you have any questions for the panel, please make sure to put them in the Q&A portion of your Zoom meeting. So we've got a few more here. So what is your favorite story about your practice in your career? So like, is there a special memory that you'd like to tell us? We'll start with Ms. McClinton.
Oh, let's see. The first, my favorite thing is when I'm able to go. One day I went to one of my centers and I was able to read to my children, and they were really, and usually children are great, hyper, getting all engaged, but they were really listening. I was reading the book, I think, of I think it was about a Dr. Seuss book about something that was going on, but maybe been Cat in the Hat, I'm not quite sure, but they were so engaged. And when I would act the book out, and I had them acting out, and I'd never taught in my life, but I thought I was teaching these 20 children, and they were all engaged, and I loved it. And at the end of the story, they all came and hugged me, and that just made my day. That children enjoyed me reading to them and acting, and they were attentive. So I loved it. So I hope that somebody remembered me in that day.
I'm sure they did. Well, it didn't just make your day. Apparently it made your career because you still remember it today.
Yes.
So. Dr. Valdez, do you have a favorite story about your practice or a specific?
Well, I'm going to speak in general terms because there's so many.
Yes.
All I can say is that having been in practice for 27 years, I've found joy in seeing my patients grow up from infancy to adulthood. I always feel proud to hear stories about their accomplishments, their career paths when I happen to bump into them or their parents. The biggest compliment is when they bring their kids to me to be their pediatrician. There are times when I get put on a spot because I do not recognize them anymore in their adult state. And they still know who I am, and they would have to introduce themselves when they bring their babies to the clinic or when I happen to see them in public. One time I was pumping gas at a station and a young fellow in the next pump greeted me enthusiastically, but I did not recognize him. He said, you took care of me when I was a kid in Holly Springs. I was so glad he spoke and happy to find out that he has a good job now at Toyota and is raising a family of his own. So little things like that. It just fills my heart.
That is wonderful.
And I just want to say one thing, Dr.
Yes.
Valdez, she was my children's pediatrician, and
See,
I
do
loved
not
it.
even remember. My mind is
And when I
Oh,
saw
family
you,
reunion,
that's what I thought. I said, I know her from somewhere. And then when I heard the name, I said, oh yes, Justin and Justin McClinton. You used to
yes. Now I remember the name. You just have to juggle my mind.
Yeah.
Small world.
Thank
Such a
you.
small world. So, Dr. Valdez, we'll start with you with this next question. What would your family say about your career path? The goodness in your career, the challenges in career. What does your family say about your career?
My family has always been very supportive. My husband and I raised 2 children, a daughter in her late 20s and is an educator, and a 23-year-old son who is in digital media. I have tried to entice them into pursuing a medical career by exposing them to the medical field, taking them to the clinic as much as I could, but they decided on different careers, and that is good. I can't force them.
Yes.
I can also say that my family loves the fact that they can get free medical advice and treatment from me, even before they have to see a real doctor. They know and understand the demands of the profession and have learned to accommodate and respect my time with my patients, especially during weekends or holidays when I have to take call.
Yes. So, Ms. McClinton, what would your family say about your career path?
They say that I'm always working.
Yep. And you both can probably say that your families think you're always working.
Yeah. Even when even when folks say that you're in the education field or you're educating kids, you're just not doing, you're just playing, but they are very supportive. My husband, I always say, I'm married to Head Start and you're married to me second. So,
well, you both have said that you have supportive spouses. And so I think
yes.
that's very important when you are successful in your career, that you have the support at home as well. You have the support in your career, but you have the support in your family. And that is essential for us all, because it is part of the health aspect of what we do. So this is the last question that we have now before we go to the questions from our participants. What has it meant to your professional practice to work through the COVID-19 pandemic? So in the middle of it, we talked about great things before and as we're coming out of it, but in the middle of it, what has it meant to you to be able to do what you do during COVID-19? Ms. McClinton, we'll start with you.
I think it has definitely really been a lot to me to work through this, because when it hit and everything shut down, our agency shut down in March, and we just didn't know what we would be doing with our children and with the staff, and me having to make decisions on whether I would allow staff to come back or whether we should stay at home to be safe. So it was a trying times. I'm not gonna say that at all. I was at home for about a week, just kind of to get myself together. And then I eventually started just allowing just a few folks to come back to the office in shifts, in order for us to make, first of all, to make sure our staff got paid. I wanted to make sure that people were getting their money so that they could continue to live at home, and making those decisions of ensuring that we gotten everything in place to reopen safely. So wanting to make sure that we're making wise decisions, not just about the business, but about the families, to ensure that we were not hurting anyone if we open back up, to ensure that I was not hurting the staff and my staff were safe, to make sure that they knew what was going on. And I was trying to make sure that we got all the PPP equipment and supplies in every center, making sure that we were just had everything in line. And my first thing was safety first. And then I wanted our children to learn, but have quality learning. But then you have to get all of that in line before you can even start doing all those things. So just taking your time, making things happen in stages. And we opened back up our face-to-face in February of this year with our children coming back in. So, and then staff, the parents still have the choice of doing virtual or having face-to-face, or doing both if they just, decided that's what they wanted to do. Just making wise decisions and ensuring that everything is safe, and now just ensuring and encouraging staff and others to go get their shots so that we can continue to be safe.
And there's that thing again where you probably had to see what the best practices were in the situation that we were in, so that you could implement them in your center. So not only were you worried about what was going on in your center and what you normally do, but now, as you mentioned, the safety. And I think that's what a lot of businesses and education were having to do. So thank you for your information. Dr. Valdez, what has it meant for you to practice during COVID-19?
Like everyone else, I was in shock that a different strain of coronavirus reached pandemic proportions, throwing everything into lockdown and hospital emergency departments and ICUs into crisis centers. It has affected the pediatric population in a different way. Infants and children, thankfully, did not get it as bad, and teenagers were a source of asymptomatic transmission. So my practice, being clinic-based, suffered a decrease in census, actually, especially during the lockdown, the earlier part of the pandemic, because everyone was staying home and were afraid to go to the clinics unless they were sick. We have had to stress the need for parents to continue coming for well checks, but had limited success. They didn't want to come. Slowly but surely, that started to change in the fall of last year, though. We are now back to normal operations as far as patient volume is concerned. We had changed our sign-in process, so patients are checked in while they are in their vehicles, actually, where they wait until they are brought directly into the patient rooms when they were ready. Since we closed our waiting rooms, we also dedicated 3 exam rooms with separate entrance and exit to children who have a history of exposure or have symptoms possibly from COVID. We had to be mindful of and always wear our PPEs and keep our exam rooms clean and disinfected. I'm thankful that myself, my colleagues, and our staff have managed to stay well, and if ever someone caught it, it was just a mild case. Of course, it was a challenge to navigate staff scheduling, especially when people would have to quarantine because of exposure or illness from the virus. Thankfully, hopefully with the vaccines, our entire staff has been vaccinated completely. This would help alleviate that.
Yes. And so you're in a different situation because medicine doesn't just stop. People don't just, not go somewhere if they're sick. And so you have had to be there at all times. You couldn't say, oh, we're just going to do virtual medicine for right now. You've had to be there and accessible. And so being able to redirect and really think about your traffic flow in special situations, it takes some amazing creativity in order to do that. So I commend you both for what you did during COVID-19. So now we have a few questions from our audience, but before I mention those, we did share in the chat a virtual copy or a digital copy of the program. So anybody that didn't have their program from some of the previous emails, there has been a link shared in the chat So please make sure that you grab that if you need to. But I have a few questions in the question and answer session. And so the first one is for Ms. McClinton. Are there health initiatives for the families of Head Start students? Do you use student nurses from nearby schools for anything with your Head Start program? So can you share your information about them?
Yes, there are health initiatives. We have LPNs in our organization are at this time, and then from the nearby colleges, we reach out and have contracts or work with those colleges for those nurses or those practitioners to come into our centers and take blood pressure, eye exams, and all of those things. We welcome that, and we love volunteers. If you want to come in and do some volunteer work at our centers, that's something we would love to have. The only thing we have to do is let us know that which colleges engaged in wanting to do that, and we can work that out. Yes.
That's wonderful to know. Thank you. And so this one is for either panelist that would like to answer. What is the most difficult part of your job and how do you overcome it? Let's start with Dr. Wiseman. What's the most difficult part of your job?
Is trying to bond with parents, especially those who are difficult. I mentioned earlier, you can't please everybody. There are parents that are very, very resistant. Dealing with obesity, that's a very challenging thing, especially if the parent is very uncooperative and doesn't really care. I mean, there are parents who don't really care. Fine, he's obese. What am I supposed to do? I mean, you know, just take some blood work, do something. Yeah. It's, I mean, you have, I am not the only one that's involved with fixing it. You're the one that buys the groceries. You're the one that has to be aware of what's nutritious, and I can only give you advice. And if you don't follow through, then it'll get worse, and there will be illness in the future. So getting them to understand that is difficult at times and frustrating. But there are success stories. And with that, I am very, very grateful for.
Well, good. Ms. McClinton, what would you say the most difficult part of your job is?
Same maybe as Dr. Wiseman, is making sure, working with parents sometimes when their child is maybe the one that's really, really need to be at Head Start, and that parent may feel that, oh, it's raining, I don't need to get up, or coming to an appointment, I don't feel like it, and won't send the child to school, and knowing that child needs to be there. And we're trying to work with that parent to move to a different direction and wanting to do some things for their lives. And they say they're not ready to do it at this point. And we feel like our hands are tired, but we're still going to encourage and still going to try. But it's difficult working with some parents and to ensure that we're getting the best and getting all the services needed for that child and that family.
Good. Thank you. So we have one more question right now. We've got others coming in. And this is from Ms. McClinton. This is a follow-up to something that you said earlier in the conversation about that you all do not use corporal punishment with your children. And so the question is, how do you redirect their energy towards something else? How do children learn consequences, or how do you reprimand that child if it's not with corporal punishment, so that they understand that their actions are something that's not appropriate and that they don't continue doing those into adulthood? So how would you respond to that?
That's why we have training for our teaching staff. Our teaching staff go to training and learn how to do different behavioral techniques to work with that child. And we have mental health consultants coming in if that child has a behavioral problem, or there's something that may be not just quite right with that child. We have our mental health specialists and our doctors come in and do observations and giving us and giving the teachers a plan, working out that plan of what needs to be done. And then we also want to work with the parent. And so that sometimes is difficult when we are trying to get that parent to come in. and say, this is what's going on. This is what the professional is saying that needs to be done. And this is what we're doing in the classroom. And then we want you to continue to do the same thing at home. And that's why I'm saying sometimes it's difficult us getting on the same timeline and doing the same thing to ensure that that behavior is changed, but it has to continue to work through those things, and it's not going to be a one-shot deal. It's something that's going to be continuous.
Right.
Can
Exactly.
can I
Yes.
say something? Okay, so I am very with pediatricians, and I in particular very grateful in being able to work with Head Start with regards to these difficult children. Okay, because it takes a village.
Mhm.
The parents,
Right.
the school,
Yes.
the doctor. Okay, so some kids will definitely be difficult because of medical concerns, like for example, they're autistic. So being in Head Start, where you all do therapies there, occupational, speech, and even behavior therapies,
Right.
that is a big help to parents, where you can do one-stop shop. Okay.
Right.
So I'm very grateful for that.
Thank you. Thank you. And when all of us are working together as a community, the doctor, the dentist, because we do dental work as well, we're doing it all. And if all of us working together for one family, then that family, as Dr. Wiseman said, there is a one-stop shop, and we can get it done, but we need everybody to help and get on board.
That's great. And thank you so much for sharing that it's not just one action that's going to assist with this process. It does take multiple individuals, a community, a village, a team. So, and also everybody has to know that they're not alone. There are resources out there in order to help get to the next level. Well, thank you so much. So let me ask Dr. Valdez, what is one character or trait that is most important to your success?
Patience. I think it's patience.
I think that's both ways. So having patients see you or having patience with your patients?
Both.
Perfect. Ms. McClinton, what would be your one character or trait?
Loving, being patient and loving, that goes hand in hand, to be able to, and listening to what's going on.
Yes, listening is very important, especially parents. You can get cues from how they interact with you and how they talk to you as to why this child is behaving this way,
right?
As to why there are certain problems, that the child is facing. So really, communication and all that is key.
So this is for Ms. McClinton. Your motto is making small miracles a great success. How did you select that?
We had a contest. And that's when I was deputy director at that time. We did a contest, and it was a parent, and we put it out there for our parents to send in their thought of what it was. And that parent, I think from Tate County, I remember it coming from Tate County somewhere, sending in making small miracles a great success. And when I read that, I knew that is our motto, because the children are small, but then with us working with them and everybody pitching in, eventually they will be successful. So I just love it. And whenever I hear that, I just beam up, because I know that Head Start, that's where you get the start, but when you finish, you will be successful to be in your community to make different things in everybody's lives.
That is wonderful. So Dr. Valdez, what is your biggest challenge with your advocating on behalf of pediatricians in Mississippi? Is there any one thing that as a pediatrician, it's a challenge in Mississippi? You mentioned obesity earlier with your practice. Is there anything else that you would consider your biggest challenge?
That is the number one thing right now, is obesity. Vaccination can be a challenge also. There are a lot of anti-vaxxers out there. And spending time with them, you have to allot a lot of time to just discussing why do you have to give this vaccine? What are the benefits? What are the risks? And if that parent is really bent on believing what she read on Dr. Google, then everything is just really doesn't happen. They will end up not being vaccinated, and vaccination is required for school. I'm not saying that most of these kids end up being homeschooled. Homeschooling is fine for some, but for others, it may not work. But because of their vaccination status, they're not able to go to school. So.
Well, and you're tying into our last question, and then we're going to be out of time, but there is a question that you mentioned the importance of vaccinations and making sure that you do get vaccinated. So the final question is about the COVID vaccine. What are your thoughts about the COVID vaccine? I'm just going to lay it out there because there's a lot of different pieces to this question, but just wanted to say, the COVID vaccine was created, quicker than others, but we also know it's a different type of vaccine. So what are your thoughts on the COVID vaccine? Are you seeing some improvements with your patients? Are you seeing, just with your medical background, what are your thoughts?
Okay, so the COVID vaccine is not indicated for the population below 16 years old. So I have no experience with it in pediatrics.
Okay.
And lately they have said that there are ongoing trials with younger kids with the Moderna vaccine. So that remains to be seen.
Okay.
As far as this being a totally new technology, no, it's not. mRNA technology has been there. It's been on the background for years. And when this virus hit us, they realized that this might be the type of technology that can be used vaccination-wise to fight this epidemic or pandemic. So safety, they went through all the phases of clinical trials, and I would say it's safe. I have received both my doses. It's been 2 months. I did not get any side effects. Of course, there are people that have said that, they felt real sick, but mostly it's just 24-hour fever, or fatigue, or malaise that was treatable with Tylenol or ibuprofen. Of course, as with every treatment or vaccine, there are rare complications like death, okay? And those need to be studied because, and it's not just for COVID vaccine, but with every vaccine. But in order for us to really get over this pandemic, vaccination is the key, okay? We have to achieve herd immunity in order for us to travel again without fear, without wearing masks, to be able to hug each other again and attend live conferences. That's all I have to say.
Thank you so much. I think you addressed several things in that area. One, that it is not a new process. And I think that's what a lot of people were concerned about. And two, it is not for your clientele or your population. So I wanted to say thank you. My goodness, time flies when you're having fun. We are out of time for this panel. I'd like to say a huge thank you to Ms. Eloise McClinton and Dr. Veronica Valdez. Thank you again for sharing your thoughts, your stories, your ideas, your wonderful responses. We now have to shift to our second panel. So we say goodbye for now, and thank you so much.
We enjoyed it. Thank you.
Thank you. Enjoyed it. Hi, Eloise.
Bye-bye.
Bye.
Take care.
All right, wonderful. Our two panelists are here.
Good morning.
So good morning, good morning. So welcome to the panel. We have Dr. Tanya Fitts and Dr. Byron Keith Watson. Each is in the clinic and on call today with a hospital, so they were able to join us for a 30-minute block of time. So thank you so much for giving back to your profession. We will get started by first asking the panelists to briefly introduce themselves. So let's start with Dr. Tanya Fitts. Please introduce yourself briefly.
Okay, I'm Dr. Tanya Fitts, and I am a general pediatrician, and I've been practicing in Oxford, Mississippi for the last 17 years. I am originally from Pontotoc, Mississippi. So I understand you guys are mostly in Colin, and I think my internet is messing up. So
You're okay.
we are having okay, we're having some rain, and I didn't know how good we were going to be able to make it work for today, but and I am president-elect of the State American Academy of Pediatrics, and I'll let Dr. Watson go.
Perfect. Thank you so much, Dr. Fitts. Go ahead, Dr. Watson.
Well, we're very close because I'm in West Point, Mississippi, not too far south of you. And I will confirm that there is rain and lightning and storms. So my internet may mess up as well. I am originally from Texas, so I am not a local. I've been a pediatrician here in West Point for almost 20 years. So Mississippi is now my second home, and I love it dearly. And I am very honored to be here this morning. So thank you for having me.
Absolutely. We are just honored to have you both here. And since you are both on call, can you explain to our audience that is out there what it means to be on call, or explain how being on call works?
Sure. On my end, West Point is a smaller town, roughly about 12,000 people. So it's not, I'm going to knock on wood as I say this, it's not horribly busy. And I don't get called out on emergencies very often. It simply means that being on call means that I am the pediatrician for our community should anything come into our local emergency room that requires more subspecialty help for our ER doctors. I can also field calls from around the community from local family medicine or general practitioners if they have a question that involves a pediatric patient. So it means for most of the situations, answering phone calls. It does also mean, however, that if there is something at the hospital, because I do inpatient as well, if there's a delivery and it's a premature baby or there's some kind of problem with an infant, I go in and I manage those. So phone calls and taking care of patients in the hospital after hours is what on call means for my practice.
Thank you for sharing. Dr. Fitts?
Well, I will say that up until last year, that's what it meant in my practice too. Oxford has since hired something called a pediatric hospitalist service. So there are pediatricians at the hospital available. And our local pediatricians, I still go, but our local pediatricians aren't on unreferred call for the hospital. So there's a lot of nuances to what on-call really means. But for us, it really just means that we're here, we're available, and it's our turn to have the phone. So like Dr. Watson, I enjoy being a pediatrician. And we've been out about the same amount of time. Let's see, what else? I think you wanted us to talk about.
Well, and I have some questions. Yep, I have some questions that I'm going to ask along the way. So I will lead you through the whole process. But the first question, and again, we'll start with you, Dr. Fitts. And if internet becomes an issue with anyone, we'll just keep going with the flow, and I'll keep talking to the one that's still available. So tell us what a typical day looks like for you, Dr. Fitts.
So a typical weekday looks like I get up and get my kids ready and take them to school, and then come into the office. I spend some time early morning organizing my day, looking at things, answering old phone calls, and doing some paperwork, and then start seeing patients as they come in, and then hopefully get some lunch, and then see more patients and do more paperwork and go home. But my patients are just delightful. And one of the reasons that I chose pediatrics is that I get to basically play with kids all day.
Amen.
And I get to smile and sing silly songs and interact and play peekaboo and pat a cake and just really enjoy what I get to do every day. And most of our assessment with children, as far as their developmental stuff, goes with that. It goes along with playing. Can they play? Do they interact? Do they look at you? Do they smile at you? And one of the things that you wanted us to address is one of the things that I've had the most trouble with COVID and wearing a mask is at a 2-month checkup, it is crucial that the baby smile back at you. And trying to get a baby to smile at you through a mask, it can happen. It's just a whole lot harder because they don't see that, don't see your lips and don't see that part of your face. So.
Well, thank you for sharing your day. That sounds like a fun profession to have, to play all day. So Dr. Watson, can you share your typical day?
Sure, and mine is a little different because we here in West Point, being such a small town, we do not have the pediatric hospitalist who is in the hospital. I am the pediatric hospitalist in addition to the nursery doctor, in addition to the clinic doctor. I have practiced long enough now that I call myself a dinosaur. I truly do exist. You just don't see them much anymore, where I kind of do it all. But I enjoy that aspect of it. So this job here is really, I would say, my ideal job. My morning starts, if I am on call, I do have a partner, so I'm not on call every day. But if I'm on call, then I will get up in the morning and I will go to the hospital first. And I will see the babies in the nursery or any kids that I may have in the hospital that are sick with the stomach virus or whatever it may be. And then I come to clinic. And then my clinic day is very much like Dr. Fitts. I answer phone calls and I get my charting done and I see my patients and we play patty cake and peekaboo and just have a glorious day playing with kids and making money for doing that. This should be it should be illegal, but it's not. And I'm glad it's not. And just in 20 years of doing it now, you know, I have some parents who were my patients when they were teenagers, and to see them now as parents and taking care of their kids, it's nothing more rewarding than that. And then my day, hopefully, in the clinic ends at 5 o'clock, depending on what's going on. And then I will go back to the hospital and check on any babies or that type of thing. So very similar to Dr. Fitts with a few differences just because we don't have hospitalists. But, you know, the bottom line is we play with babies and it's wonderful.
When it seems like you both have a true passion, that it's almost like it called you to that field. So can you tell us, and we'll start with Dr. Watson, then we'll go to Dr. Fitts, a story of how you came to be a pediatrician? You know, so how did you choose pediatrics, or how did it choose you?
Okay, so this can be a very long answer, so I'll do it as quickly as I can. I'm a weird person in that I knew very early. I decided when I was probably 11 or 12 years old that I was going to be a pediatrician. I loved kids. I've always been good with kids. My mom, even when I was young, noticed that I had a natural affinity for kids, and science and those types of things always interested me. So I decided very early I wanted to be a doctor. And my mom was the one that kind of brought out in me, that's a great idea, be a doctor, because it's a wonderful field, but you really ought to think about pediatrics because of how much you love children. And it just always made sense to me. It was that simple of a thing. So I did not do a lot of soul searching in college trying to figure out what my role in this world was going to be. I decided very early in college and med school and became a pediatrician, which is what I always wanted to be.
Well, that is very unique because most people have no idea what they want to be, even after school.
I have 3 children right now
wonderful.
who have no idea. So yes, I am very much the abnormal person in the family.
That's right. So Dr. Fitts, how did you choose to become a pediatrician?
Well, like I said, I grew up in rural Pontotoc County, and I actually knew I wanted to be a scientist, and I loved math and science. So I was in one of the first classes to graduate from the math and science school over in Columbus. And while I was there, decided that I wanted to be a physician. And so from there, I went to college and had my way in college, and then on to medical school in Jackson. And while I was there, I began getting mentorship from the Department of Pediatrics. Dr. Joe Donaldson and Dr. Will Story really I worked with them one summer, and they showed me just exactly how wonderful it is to take care of little people and their families as a whole. Pediatrics, and I kept an open mind after that, but throughout my clinical rotations, I was really so much more drawn to pediatrics than internal medicine and OB and, all of the other things that you could possibly be. And so I decided my third year to be a pediatrician, and I love taking care of all aspects of being a pediatrician. And while I'm not going to the hospital on a daily basis anymore, I still do miss it, Dr. Watson. I love going to deliveries and resuscitating a baby. And I'm to the point in my career where I also have grand patients. So that's kind of my journey to being here, and finding that mentorship was really a key. And that's one thing I want to encourage the participants of this to get. It's to identify a mentor, identify somebody that you want to be like, and see what it means to be like them, so that you have something and someone to go back to and talk to. And then when you get to be my age, become a mentor.
I think that is
and help the
excellent
people.
advice.
Yeah.
That is excellent advice, because so many people go, oh, I want to be like that person. Well, get to know that person, befriend them, and they can become your mentor. So that is fantastic advice. One of our questions is, what has been the most remarkable thing about your career path with COVID-19? So, any changes, any positive things that have come out of it, anything negative that's come out of it, just, with COVID-19, share something about your career path. And we'll start with Dr. Fitts.
So the main thing with COVID-19 that has changed is that we get to be part of the scientific community that finds out about a new virus. So we know about all the other viruses. Pediatricians are very adept at all kinds of infectious diseases. This is what we train for. But the shape-shifting of this virus and what we know about it over the last year has been frustrating, but also very thrilling when you take a step back. And as we go through and go forward with this, the one thing that has helped is being resilient as a person and being able to not be stressed out when there's not as much money in the bank to pay your to pay your employees. And that the business aspect of the COVID-19 has been the most challenging aspect for me as I own my own practice. Luckily, we've had some great federal money to help us out. And that's been the most challenging. I think the scientific part is something that we trained for and prepared for, but the business side was what has been most challenging for me. I don't know, Dr. Watson might have something different.
Well, thank you for sharing that, because that is another side that people don't always think about. So when you're in medicine, it's the business side. So thank you for bringing that up. Dr. Watson?
Can I just respond with ditto?
Yeah. Absolutely.
Yeah, there are challenges of dealing with a new virus and the unknown. Was this going to be a virus the likes of, something like Ebola that was going to, kill 90% of the people it affected? Or was this going to be more of what it was, a respiratory virus that most people recover from, but there are complications in some people? That was the scientific part of it that, yes, was from our standpoint as doctors interesting, maybe not enjoyable. But the business aspect of all of this was very challenging. My situation is a little different. I work for North Mississippi Medical Center, so I am an employee. So I have a paycheck. So the less money was not something I had to deal with. So I'd say the most challenging part for me, probably due to my specific position, was finding a way to still get access to medical care for our patients who were fearful of coming in and sitting in a waiting room next to other people. And so these teleconferencing visits like this, or telephone visits that we conduct, and getting those off the ground and running so we could talk to our patients over the phone if it was something that maybe didn't need visual confirmation. I see patients that have ADHD. And so medicine checkups over the phone, where I don't necessarily need to see the patient, was trying to get those coordinated and getting some kind of business model set up to see patients when we had patients fearful of coming in. That may have been the most challenging on my end, but I will concur with Dr. Fitts. It was the business aspect of it, and trying to still get patient care and see patients and do what we needed to do from a standpoint of paying the business.
Oh, it's almost that you want to recommend to any students going into medicine or some sort of medical field to make sure you get some of those business classes too, as you're preparing for the real world. So what would be the best advice for newcomers coming into pediatrics? So Dr. Watson, we'll start with you. The best advice for newcomers.
Wow, that's a tough one. I could probably turn this into an hour talk and give you 3,000 pieces of best advice. I guess the best one is, if this is absolutely what you want to do, and you know beyond a shadow of a doubt this is what you want to do, then be consistent and be aggressive in making sure that you obtain your goal of being. If you want to be a pediatrician, then be a pediatrician, and don't worry about all the things you hear bad about going into medicine. Oh, medical school and all the studying and residency where you don't sleep at night, and all of these things that make this job so hard. That's early on. That's the process that you go through. But when you become the pediatrician and you obtain that goal, that sense of satisfaction of reaching that goal is the most rewarding thing you can probably experience throughout this career, outside of playing with babies. So my best advice is, people thinking about coming into this, if that's what you want to do, don't let anybody discourage you from going for it.
That's excellent advice. Because there are a lot of barriers that occur on your way to becoming a physician. So just keep going and keep going is what I'm hearing Dr. Watson say. So thank you. Dr. Fitts, best advice for a newcomer?
It depends on where you are in your journey. Definitely encouraged. I would encourage people to do it, but I would also encourage people to begin practicing setting boundaries between what is their career and personal life, and making time to do things that restore and regenerate themselves, and also growing their relationship within their own family unit, and also and not letting, because medicine will take you over, and not letting the practice of medicine take you over, and not feeling. A lot of women, because I'm addressing women here, a lot of women feel guilty to say no, and saying no and prioritizing what really is your priority in life is one of the things that I've really had to learn, especially in this last year. Just to say no if it is not something that is that is a priority for your life.
I'm gonna say no, thank you.
Yeah, no,
Just so it
thank
feels
you.
a little bit better.
Thank you for thinking of me, but
That's right. That's right. So, Dr. Watson, did you have anything to add to that? I didn't know if you were coming.
That's, yeah, I think I may want to change my answer. That's a really good one too. I precept students for several schools around the state. In fact, across from me now, there's students sitting who are enjoying this 30-minute break from having to work, probably. I always caution them that being a pediatrician is what I do. It's not who I am. I am Keith Watson. I am a husband. I am a father. I am a Harley Davidson motorcycle rider. I am a weightlifter. These are things that I do and enjoy. I'm an outdoorsman, and those are things that I still make time to do. You have to have personal health to be a good professional and provide professional health to other people. So I agree with Dr. Fitts completely. Those things that you are or that you were before you started, you still have to be.
Right, exactly. You can't lose your identity.
Absolutely not.
And so this question is, in your opinion, please share the importance of being involved in professional organizations in your community. And Dr. Fitts, I know that you hold an office position in an organization, so please share with us the importance of being involved and share about your organization as well.
So I am president-elect of the State American Academy of Pediatrics, which is kind of our little chapter of a much bigger organization, which is the American Academy of Pediatrics, which represents all the pediatricians in the US, basically. And the importance of being a member of that professional society are immense. So the American Academy of Pediatrics provides continuing education. It provides there are different sections based on things that you're interested within pediatrics. So you can get involved with other pediatricians who share your own same interest. And I'm a member of the section on breastfeeding, the section on obesity, and the section on practice management. Those people and those emails and listservs and those things, they help me grow as a human and help me become a better pediatrician every day. And on a more local level, it's important to be involved in our professional organizations, because right now we're in the midst of the legislative session, and being an advocate for legislation that protects our patients, that expands telehealth, that supports our Medicaid population, because most of the children in Mississippi are on Medicaid. So most, it really impacts us. What goes out in the Medicaid reauthorization bill, expanding coverage for postpartum care so that the mothers of our children will have some care after that first year of life, when they can have complications, they can have depression. And being a part of a bigger group that goes to the legislators and the legislators that say, look, these are the things that are important to us as physicians and as pediatricians, and this is why we don't like these wording of that, is very important. And when you have becoming the voice of those people and becoming a leader and becoming practicing how to do it nicely is very important for not only me, but for everyone in the state, right? And grouping together as a professional organization is so important, so that there is a louder voice and not just a tiny voice.
And just to put it in kind of simpler terms, sometimes you get stuck in your own little bubble or your own little place. And then whenever you're part of these organizations, you realize this is affecting a whole lot more. And we need to make sure that everybody's on the same page, working for the same interests of our patients and our population. So we have a lot of students that are on with us today. Is there any way that they can get involved in these organizations early, or do they have to wait until they are in the field and are already practicing? I know sometimes they're student members.
Yeah, that's right. So the American Academy of Pediatrics and our Mississippi chapter offers student memberships. Those so anybody who is on from that will be at William Carey College of Osteopathy or the University Medical Center. That student membership is next to nothing, and I've volunteered to cover. It's $10, and I think I can. I've told Deanna I can cover whoever needs to be on that if they're interested. At the University Medical Center, there is a pediatric interest group. So once you get into medical school, there is a group of students that are interested in pediatrics. They will hook you up with mentors within the university. I think it's called something different at, I think it's called the PIG at the University Medical Center, and it's called the POG at William Carey. So, so there's 2 pediatric interest groups that will help expand that mentorship. There are benefits to being student members, and then residency members. Of course, you can become residency, and then there are different levels of membership, of course. And then once you're a full-fledged board certified pediatrician, you have another level of mentorship. It's very important if you're interested to get involved early. We will teach advocacy as part of that, where we teach you how to go and talk to your legislators, how to write a letter in support of legislation or in support of a policy. So, and doing that not just on the state level, but also on the federal level as well.
Well, and I think that's essential to share with our students today, that if you are in the area that you want to be or you think you want to be, it's important to get involved now. And so look for those organizations that'll help support your growth, that can match you up with a mentor if possible, or even guide you to a practice or a specialty that you may not know about right now. So we are almost out of time. I'm going to ask if there are any final words that either of you would like to share, Dr. Fitts or Dr. Watson.
I'm going to let Dr. Watson go first.
First of all, thank you for having me. As I will always happy to do things like this. For the students that are listening, get involved. And I concur with Dr. Fitts. You don't necessarily have to be in the AAP or those types of organizations if that's not your thing. But I agree completely that getting involved early is something that helps you along your journey with your work experience and those types of things. So if you're interested in pediatrics, the shadowing of physics, call up a local pediatrician. I don't know if Dr. Fitts does this or not. She may very well, but call up your local pediatricians and see if you can come hang out. Now, I know with COVID restrictions, we may not be able to do this right now, but come hang out for the day, see patients with the doctors, get an idea of what you want to do, see if that's really the field you want to go into. But she's absolutely correct. Get involved early and learn as much as you can about the process. It's a wonderful field. I couldn't imagine doing anything else. And I hope to do it for several more years and continue to enjoy it like I have. So you guys that are out there listening, if you're wanting to be pediatricians, stick with it. As my father used to say, keep your nose to the grindstone and work hard. And if it's not pediatrics and it is internal medicine, whatever it is, go for it, work hard, get involved, learn all you can about the process, and enjoy every day that you do it.
Wonderful. Thank you, Dr. Watson. Final words, Dr. Fitts. We're out of time.
Oh, we're out of time. Okay. Well, thank you for inviting me and having me. And I would also say, get out and do it. Find something that you enjoy doing so that you don't actually feel like you're going to work every day. And that's
Amen.
how I feel. Okay.
Wonderful. We sincerely appreciate you both and your dedication to the profession. This concludes our session. I would like to thank the panelists for their time and wealth of knowledge they brought to our participants this morning. I hope everyone has enjoyed the health presentations and conversations. At this time, I'm going to ask Dr. Ricardo if she has anything she'd like to share before I turn it over to our past AAUS president. Okay, so is Judy McNeese with us to take it to the closing? see, is Judy with us?
Hello,
Oh, hi, Judy. How are you?
I'm okay. I can't figure out how to get on video, but it's just as well. Oh, look, somebody did something. Start my. Oh,
There you go.
Well, thank y'all all for participating today. It's been great in this new strange world. Thank you, doctors. It's been really nice hearing what's going on in the health field. And I want to welcome everybody to come back tomorrow as we talk about business in the hope part of our convention. And that's at 8:30 in the morning. And Dr. Fitts, I'm in Copiah County. So I will be looking you up. Everybody come back tomorrow. Thank you.
Thanks.
Thank you, Judy. Thank you, Dr. Duguid, Dr. Fitts, Dr. Watson. We'll see you all soon. Thank y'all so much.
And thank you to our
Wonderful day.
participants. This concludes our session for today. We will see you tomorrow.